Ever wondered if a seemingly harmless vitamin could actually harm your kidneys? What if I told you that a common supplement, taken daily by thousands, could lead to severe kidney damage? Stay with us as we reveal how this unsuspected vitamin turned a routine health choice into a dangerous health crisis. You won't want to miss the details. In December 2012, a 55-year-old woman with kidney disease was rushed to the hospital. She was very weak. Her heart was beating slower than normal, and her body temperature had dropped to 93 degrees Fahrenheit. Her body was also swollen, which alarmed the doctors. Fearing her kidneys had worsened, they checked her creatinine levels, a marker for how well your kidneys are working. The results shocked everyone. Her creatinine levels had shot up to 3,530 milligrams per deciliter. This was a sign that her kidneys were failing fast. She wasn't even producing urine anymore, meaning her body was full of toxic substances. Doctors immediately moved her to the ICU and started her on dialysis the same day. But what caused her condition to get so bad so quickly? After a lot of tests, they found the unexpected cause, a common vitamin supplement she had been taking daily. Yes, a simple vitamin that many people use was behind her sudden kidney failure. The hidden risks of vitamin supplements. Most people think vitamins are safe, especially because they're sold over the counter. But did you know that using the wrong vitamins, or even too much of them, can be harmful, especially if you have kidney problems? It's not just prescription drugs that can cause health issues. Over-the-counter vitamins can also be risky. While skipping all vitamins can harm your health, it's really important to be careful about what and how much you take. Today, we'll talk about 5 vitamins that can be especially dangerous for people with kidney disease. But before that, let's look at other cases of vitamin misuse leading to serious health problems. There was a TikTok influencer who ended up with kidney stones after taking vitamins to boost her immune system. Another case involved a 61-year-old man who was in terrible pain, which was first thought to be pancreatitis, but later linked to his vitamin supplements. In another worrying case, a patient had severe vomiting, leg cramps, and lost 28 pounds in just a month. The cause? Overdosing on vitamins, which eventually ruined his kidneys. These stories show just how important it is to understand the supplements you take. People with kidney disease are especially at risk because their kidneys can't filter out extra vitamins well, which can lead to dangerous buildups. So, understanding the right way to use vitamins is key to protecting your health. 5 dangerous vitamins you should know about. Now let's dive into the vitamins you need to be cautious about, especially if you have kidney disease. Vitamin number 5, vitamin D. Vitamin D is crucial for bone health and helps support your kidneys. But you need to manage your intake carefully. Vitamin D is fat-soluble, meaning it stays in your body longer, and taking too much can cause problems. High levels of vitamin D can lead to serious conditions like too much phosphorus or calcium in your blood. This can cause your arteries to harden, which is dangerous. In rare cases, too much vitamin D can even cause acute kidney injury. To avoid these risks, it's recommended to stick to a daily dose of 2,000 IU and combine it with vitamin K2 and magnesium, which helps balance calcium levels and keeps your arteries healthy. If you care about your kidneys or know someone who might benefit from this information, vitamin number 4, synthetic vitamin B12. The next one on our list is cyanocobalamin, the synthetic form of vitamin B12. Unlike the natural version methylcobalamin, this type of B12 is man-made and cheaper to produce. But it may not be as safe, especially for those with kidney problems, because it's harder for the body to process. Too much synthetic B12 can cause toxic buildups, making it dangerous for people with weak kidney function. So, it's best to look for natural vitamin B12 supplements whenever possible. Be informed and protect your health. These examples show why it's important to know what's in your supplements. Just because something is sold over the counter doesn't mean it's completely safe, especially if you have kidney disease or other health issues. The key is finding a balance. While vitamins are important for your health, taking the wrong ones or too much of them can cause serious problems. Did you know that the synthetic form of vitamin B12, called cyanocobalamin, is found in many multivitamins? While it's widely consumed, this version of B12 can be harmful, especially for individuals with chronic kidney disease, CKD. Cyanocobalamin contains small amounts of cyanide, which the body normally processes and removes without any issues. However, in people with reduced kidney function, such as those with a lower glomerular filtration rate (GFR), the body struggles to eliminate cyanide effectively. This can lead to a dangerous buildup of toxins, which could speed up kidney damage. Research has shown that taking high doses of cyanocobalamin can produce small amounts of cyanide. For people with CKD, this can worsen kidney function even further. Because of this, it's crucial for those with kidney issues to be extra cautious and choose a safer alternative. Methylcobalamin, the natural form of vitamin B12. This version is easier for the body to handle and is generally recommended at a daily dose of 6 micrograms, especially for individuals on a plant-based diet. Why is this so important? Vitamin B12 is often poorly absorbed, especially in its synthetic form, which leads manufacturers to pack supplements with large amounts of cyanocobalamin, sometimes up to 100 times the recommended daily intake, RDI. While these high levels ensure better absorption, they also increase the risk of cyanide buildup, especially for people with impaired kidney function. If you're following a renal diet, you'll still need vitamin B12 to prevent deficiency, which can lead to severe health issues like vascular disease and anemia. However, it's important to choose the right form and dosage. Consistent deficiency of vitamin B12 can cause significant health problems, so supplementation is necessary, but it must be done carefully to ensure it's safe. If you have CKD, it's a good idea to carefully check your vitamin labels to make sure you're taking methylcobalamin, not cyanocobalamin. By doing so, you avoid the risks associated with cyanide while still getting the benefits of vitamin B12, which is essential for overall health. Vitamin number 3. Synthetic vitamin E. Continuing with our countdown, the third vitamin that poses serious health risks is a common one: synthetic vitamin E, also known as alpha-tocopherol. Research has linked this form of vitamin E to increased blood pressure, a higher risk of stroke, and even cancer. It can also lead to bone loss, higher cholesterol levels, and kidney damage in the general population. Despite these risks, synthetic vitamin E continues to be widely used in supplements and other products. If you have kidney disease, the dangers are even more pronounced. That's why I always advise against taking synthetic vitamin E, especially if you're dealing with kidney issues. Alpha-tocopherol is found in many common products, including supplements, health powders, drinks, and even food items. The issue with synthetic vitamin E is that it doesn't offer the same benefits as the natural version, and it can actually cause harm, especially for those with kidney disease. Natural vitamin E, on the other hand, is a powerful antioxidant. Antioxidants play a critical role in managing and treating kidney disease because they help protect the body from damage caused by harmful molecules. However, even though natural vitamin E has potential benefits, I still recommend against supplementing with it unless your doctor specifically prescribes it, particularly if you have kidney problems. If you want to safely add vitamin E to your diet, it's better to focus on food sources. Sunflower seeds, for example, are an excellent source of natural vitamin E. Just 1 ounce of these seeds can provide up to 66% of your daily vitamin E needs, making them a healthy choice for anyone. In summary, while natural vitamin E has its advantages, the synthetic version, alpha-tocopherol, carries significant risks and should be avoided, especially in high doses. Always consult with a healthcare professional before taking any form of vitamin E, particularly if you have a condition like kidney disease. Vitamin number 2, vitamin A. Vitamin A takes the second spot on our list for the potential harm it can cause, especially when it comes to kidney health. It's even more dangerous than synthetic vitamin E for people with CKD. Although vitamin A is important for vision, immune function, and skin health, too much of it can lead to toxicity. This is particularly true for those with kidney disease. Excess vitamin A builds up in the body because the kidneys can't filter it out properly, leading to a toxic overload. In people with CKD, vitamin A toxicity can cause a range of problems from nausea and headaches to more severe issues like bone pain, vision problems, and liver damage. In extreme cases, it can even lead to coma or death. It's important to note that vitamin A comes in 2 forms: preformed vitamin A, found in animal products, and provitamin A carotenoids, found in plant-based foods. The preformed version is more likely to cause toxicity, so people with kidney disease should be especially careful with supplements that contain it. If you have CKD, you should avoid vitamin A supplements unless your doctor recommends them. Instead, you can get enough vitamin A from a balanced diet that includes foods like carrots, spinach, and sweet potatoes, which provide provitamin A carotenoids. While vitamin A is an essential nutrient for maintaining good health, it can be dangerous when taken in large amounts, especially for individuals with chronic kidney disease, CKD. If you have compromised kidney function, taking multivitamins that include vitamin A may pose serious risks. Popular brands like Centrum, Smarty Pants, or Superdin, which is commonly used in Europe, could be harmful to people with kidney issues. The problem lies in the way damaged kidneys struggle to filter out excess vitamin A. Normally, our kidneys remove the extra vitamins and minerals we don't need, but when they aren't working properly, vitamin A can build up in the body, turning toxic. This toxicity can lead to severe health problems, including liver damage, birth defects, and even faster kidney deterioration. Vitamin A toxicity is often linked to the overconsumption of specific foods, such as fish liver, which is extremely high in vitamin A. Although cases of acute kidney injury from food sources are rare, they do happen. Overindulging in foods like these can lead to hospitalization, making it clear just how dangerous vitamin A accumulation can be. Even natural sources of vitamin A can pose health risks when consumed in large quantities, especially for those already battling CKD. Additionally, many over-the-counter multivitamins contain levels of vitamin A that are unsafe for individuals with reduced glomerular filtration rate, GFR, a common problem in CKD patients. Since vitamin A can stay in the body, it's crucial for people with kidney impairments to monitor their intake carefully to avoid toxicity and further kidney damage. In summary, while vitamin A is important for overall health, individuals with kidney disease need to be particularly cautious. It's always best to consult with a healthcare provider before taking any supplements and to avoid large amounts of vitamin A, whether from food or multivitamins. Vitamin number 1. The hidden dangers of vitamin C. Taking the top spot on our list of risky vitamins is none other than vitamin C. Known for its immune-boosting benefits, vitamin C is generally seen as a safe, everyday supplement. But for some individuals, especially those with kidney disease, this essential nutrient can become a serious health hazard. Let's look at the case of a 55-year-old woman whose kidneys suffered catastrophic damage due to her high intake of vitamin C. As part of her daily routine, she took a range of supplements, including calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and of course, vitamin C. Like many people, she relied on these supplements for her overall health, but little did she know that one of them would lead to her rapid health decline. Doctors were initially baffled by the sudden deterioration of her kidney function. It wasn't until they performed a kidney biopsy that they discovered the cause: an accumulation of oxalate crystals. This condition is closely tied to excessive vitamin C intake. She had been taking 1,000 milligrams of ascorbic acid every day, which is a common dose recommended for boosting immunity. However, for her weakened kidneys, this was far too much. Vitamin C is usually celebrated for its powerful antioxidant properties, which help protect the body, support the immune system, and even improve iron absorption. But when taken in high doses, especially by someone with kidney disease, it can become dangerous. Her kidneys were unable to process and eliminate the excess vitamin C, leading to a buildup of oxalate crystals. For healthier individuals, this could result in kidney stones. But for someone with already compromised kidney function, the damage can be far worse, as seen in this unfortunate case. This woman's experience serves as a stark reminder that even vitamins considered safe can be harmful if not taken in moderation. For individuals with kidney disease or other serious health issues, it's crucial to have medical oversight when taking supplements. What's beneficial for one person can be dangerous for another, especially when the kidneys are involved. The connection between vitamin C and oxalates. When vitamin C breaks down in the body, it can convert into oxalates, which are natural compounds that need to be filtered out by the kidneys. In healthy individuals, this process happens without issue. However, for those with impaired kidney function, oxalates can accumulate, leading to the formation of crystals that can block the kidneys. Over time, these oxalate crystals can cause kidney stones, or in more severe cases, contribute to kidney failure, as in the case of the 55-year-old woman. This situation highlights the importance of keeping a close watch on your vitamin intake if you have any underlying health issues, especially related to the kidneys. Regularly consuming large doses of vitamin C may seem harmless, but for those with compromised organ function, it can lead to severe consequences. Caution and prevention. Protecting your health with the right approach. Vitamins are vital for maintaining good health, but they need to be taken with caution, especially if you have pre-existing health conditions like CKD. The story of the 55-year-old woman is a sobering reminder of what can happen when supplements are taken without proper guidance. It's a call to action for everyone to become more informed about what they're putting into their bodies. Before starting any new supplement, especially if you have health concerns like kidney disease, it's important to consult with a healthcare provider. They can help you figure out the right dosage and ensure that the vitamins you're taking won't harm you. It's also important to recognize the symptoms that might indicate you're taking too many vitamins. Changes in urine output, swelling, fatigue, or abnormal heart rate could be signs of vitamin overload. If you notice any of these symptoms, seek medical advice immediately.